Let's work with the last video of this unit, that is personal care, and we're gonna work with the last objective, that is assess and treat wounds, okay? First, I want you to observe this image. This is a process to check a wound. So there we have different images with different elements and different steps. So how would you organize this? What would you say is the first step, the second one, the third one? What elements do you need? So let's start with the vocabulary here, okay? These are some of the elements that you can use when you are managing wounds, okay? For example, this. How do you call this? Do you know how to call it? Yes, it is an absorbent dressing. Could be absorbent or not, but it is a dressing, okay? Now this is easy. We checked something similar in one of the previous unit, okay? But specifically, this is an antibiotic. This used to prevent contact with any possible pathogens during wound management. So these are disposable gloves. Protective covering placed over a wound. In this case will be dressing, okay? That is why in the previous one we have absorbent dressing, okay? Because that is the specific one, or it could be whatever thing that you use to cover the wound. A can for trash or garbage will be a bin. A sharp side formed by the intersection of two surfaces of an object is an edge. Then we have this fluid created by an infection. Pause. If you observe, the writing is the same as in Spanish. Yes. And with this, we have finished with this vocabulary. Okay, so these are some of the elements that you can use when you are checking on a wound. So what I will ask you to do now is you're going to be checking the recording, and I want you first to tell me the different elements that have been used here. For example, you know now that these are disposable gloves. You're gonna have here a dressing, and normally this dressing after used can go to the bin, okay? Then we have here, this is something that we didn't check in the previous activity, that is sutures, okay? Then we have here, it was not also mentioned in the previous one. Something is missing there, so you need to check the presentation because the one in the content part is complete. So this is the saline solution. And yes, in this recording we have the steps that are followed to manage a wound. Something else that is necessary when you are assessing a wound is this beautiful chart. Similar to the previous charts that we have been using to fill in reports, we have different information. Here we have the name, date of birth of the patient. And now observe the type of things that we can include in this chart. So first, we're going to talk about the type of wound. If it is traumatic, because someone hit, because, I don't know, you crash against something. Surgical, obviously after a surgery. Burn, this is obvious. Diabetic ulcer, pressure ulcer, or any other. Then the location of the wound. Well, in this case we have left because this is part of an activity, but it could be whatever place, the abdomen, the back. Do you remember when we check the parts of the body? Yes, you're going to use them here. Then we can determine if there is or there isn't an infection. Dressing frequency, how often the dressing is changed. 3 times a day, twice, once, or every third day. If the person is consuming antibiotics, yes or no. If they are oral or, I don't know how to say this in English. Well, IV, when you use the vein, intravenous. I really don't know, sorry. The other, check the spelling. This is the British spelling. Don't forget that we are using a British book. Okay, yes, slight or no. We will retake this idea of pain assessment. Okay, sometimes a wound causes pain, so we again have this scale. The wound closure, if it has sutures, okay, like this one, you know them. If it has clips, these little pieces of tape that you use when trying to cover a wound, and then open wound. Then a wound dressing, Okay, not applicable, antimicrobial, antimicrobial, hydrating, absorbent, okay, and then any other comment that you can have about this gund, okay. Now observe, here we have an example. What I want you to do is you're gonna be checking the recording, you're gonna observe the type of information that you have here, and then you will find then the correct answer here. For example, check this.
Hello. Can you just confirm your name for me?
Una Higgins.
Great. Thanks, Miss Higgins. So, how are things after your operation? Let's see.
Okay, if she has gotten an operation, what type of gund does she have? Traumatic, surgical, burn, diabetic ulcer, pressure ulcer, or other? What do you say? Yes, surgical. Okay, so the idea here, people, is that you check the recording again and you can check the information, if there is infection or not, how frequent this woman is using the dressing, if she's taking antibiotics, what about other pain assessment, gund closure, and gund dressing. Okay, so you will find all this information in the recording and you will find the answer similar to this one. Okay, and now that we have talked about this, are you ready to practice?